order, the highest one right off of the pubic tubercle is the pectineus. So that's the one that you can actually palpate through the clothes. So the only muscle that you can palpate through the clothes is the pectineus. Okay. The rest of them kind of go in order: brevis, longus, magnus. Okay, because the brevis and longus pretty much run on top of the magnus. There's not distinct borders that says, okay, I can feel that the brevis stops here, the longus stops here. It doesn't work that way. They kind of run as a group. Just know the brevis is going to stop pretty proximal on the posterior femur, and then the longus comes a little bit further, and then you know the magnus comes all the way down because it comes all the way down here to the adductor tubercle. Okay, so if you're down here, this is magnus. Don't tell me this is brevis or longus way down here, because it's not. This is magnus. And then the further up you go, you're going to get into the longus, and then closer up is the brevis, and then that tendon, if I crush your foot over your opposite knee. Yeah, like that. The whole figure 4 position, that tendon that pops out is kind of the common adductor tendon because they run so close together coming off of the pubis. So even though they have slightly different origins on what part of the pubis, generically they all attach to the pubis. So they all have this common kind of tendon area as they come off, and that's what you feel when you put somebody in this position. That's your adductor tendon. Okay, the pectineus is a little higher than that because it's a hip flexor, but the brevis, longus, magnus are kind of coming down together as a group. The brevis coming this way, the longus coming this way, and then the magnus coming all the way down to the adductor tubercle.
From there?
From the pubis. Yep, from that tendon.
That tendon.
Yep.
Okay.
And if I follow that tendon up, that's your pubic tubercle and your pubic rami, basically. So it comes off that edge of your pubis. Okay? They're all obturator nerve except for pectineus because it's also a hip flexor. So it is femoral nerve, not obturator nerve. And I believe they're all L2, L3, L4? Or L3, L4. Gracilis. Oh, I gotta throw gracilis in there. I almost forgot about it. Pectineus is 2, 3, and 4. It's femoral nerve because it's a hip flexor adductor. But longus, brevis, and magnus are 3 and 4. And then gracilis is 2, 3. Okay, gracilis, also starting at the pubis, but it comes straight down. So the adductors kind of come this way. Gracilis comes straight down. So if I find the adductor group and I go more medially, I'll find the gracilis. The gracilis is a very thin muscle. It is very difficult to palpate way up high, just because the rest of the adductors are there. Where you'll get it is distally as it goes to its attachment on the anterior medial tibia. It has a very important attachment on this anterior medial tibia with 2 other muscles. That common insertion, have you guys heard the term pes anserine? Okay, your pes anserine, 2 words, P-E-S, anserine, A-N-S-E-R-I-N-E, pes anserine. It's Latin for goose foot, and it looks like a goose's foot because of the 3 tendons of the sartorius, the gracilis, and the semitendinosus all come down and commonly attach on the anterior medial tibia as your pes anserine. So your pes anserine is its special name, meaning goose foot, because the sartorius comes this way, the gracilis comes straight down, and then the semitendinosus comes from the back, and they all converge right here on the anterior proximal medial tibia to look like a goose's foot, like kind of webbed out. That's why it's called the pes anserine. Okay, and it's just the common insertion on the anterior medial tibia. So come comp time, you could say the gracilis inserts on the anterior medial tibia, and guarantee a follow-up question's coming. What else inserts there and what's its significance? Well, it has a common insertion called the pes anserine with the sartorius and the semitendinosus. But per your card, it's still anterior medial tibia. But it has this clinical and anatomical significance that common insertion is called the pes anserine. Okay? So getting the gracilis as far as palpation, your best bet is distal medial thigh and then into its insertion. Now, if you get too far, you're going to be into the hamstring tendons. Don't be way back here. Those are hamstring tendons. But sometimes people will find the hamstring tendons first and come up, and then you'll get the gracilis. If you still have trouble, do resisted adduction. Pull in. And you'll feel it. Again, it's maybe the width of my thumb, maybe not even that wide. It's a really long, skinny muscle, but it runs very vertical. So if you have them do resisted adduction and you feel like it at an angle, you're probably on the adductor magnus and you're probably up too high, because the adductor magnus is up here off the adductor tubercle. Go posterior to that, and the tendon that you feel running vertically is the gracilis. And then as you go up, you kind of lose it in the rest of the muscle belly of the other adductors. So it's not really defined proximally all the way to the pubis. Your best bet is to palpate it down in here. Okay? As far as concentric, eccentric with the adductors, you can do it supine, but I think it's easier sideline with the leg that you're testing on the bottom. So you're gonna lay on your right side. Okay, so you just need the top leg out of the way. You can have them put it up this way if they're flexible enough, or you can have them put it behind. Just be careful if you put it behind that they don't cheat and use their hip flexors and not their adductors. So if they can do it this way, I'm gonna do it this way. Straighten your bottom leg. Okay, so you can test them as a group, the adductors as a group, by lifting your leg straight up towards the ceiling. That's concentric. Keep pushing up as I push down. That's eccentric. Okay? If I flex her hip a little bit and then have her lift, that's more pectineus, because it's also a hip flexor. Okay? So now I want you to lift your leg towards the ceiling. That's more pectineus, pectineus, tomato, tomato. Okay? And then hold as I push down. Make sure, even though the gracilis does cross the knee, if you're resisting adduction, resist above the knee. You don't want to torque the knee by resisting down here, because all of the insertions are proximal to the knee except the gracilis. Okay, so make sure your resistance is here and not here. Okay, we'll talk about the gracilis when we talk about knee flexion. It kind of helps with knee flexion as well because it crosses the knee. But its main job is it's a hip adductor. Okay? Questions on the adductors? All obturator except for the pectineus femoral nerve, because it's also a hip flexor adductor. They all originate in the pubis, with the magnus having an additional origination in the ischium, and then they insert pectineal line. The pectineus is pectineal line, the brevis is pectineal line and linea aspera, the longus is linea aspera, and the magnus is adductor tubercle and linea aspera. All hip adductors. Oh, gracilis insertion is anterior medial tibia. All hip adductors, all obturator nerve. 2, 3, 4 for